Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop wrist pain. But before I do that, I will go over the causes, risk factors, basic anatomy, normal healing cycle, and how to get to the root cause of the wrist pain and how to relieve it at home. So there's several causes for wrist pain. One of the common causes is arthritis. So you will start to have arthritic changes in the wrist joint, and that causes inflammation, scarring, and a lot of compression on the median nerve, and could cause numbness, tingling, and weaknesses. The other common cause is osteoarthritis, which actually wear and tear in the joint, and that's happened from a lot of repetitive movement like typing or occupation like using a hammer or any other occupation or sports that require a lot of wrist movement. Also carpal tunnel, another carpal tunnel syndrome, another risk factor, and I have a video on carpal tunnel on my YouTube channel. Feel free to check it out. Decrovant and the tendinovitis, I actually have a video on that specifically in my YouTube channel. Just check it out. And usually have it here around this area. You start to have like inflammation in the tendon and in the extensor retinaculum, which is actually a fascia, and swelling, and you start to have a scarring in this area. That's the decrovant tendinovitis. And the carpal tunnel, you start to have inflammation that compressing on the medial nerve right here in the middle of your wrist and cause a lot of numbness and tingling in the hands. The other thing that could be a risk factor, not very common, but some people might have it, is Galgonian cyst, which is inflammation in the cyst here that cause swelling in this area, or you might have it from injury, from accident, trauma. So, symptoms. You might experience weaknesses in the hands, swelling, redness internally, and also numbness or tingling if you have like a carpal tunnel syndrome. It will be hard for you to grip or open a doorknob, or sometimes dropping objects. You will feel like a lot of stiffness in the hand and the wrist area. Those are the symptoms. Other risk factors could be you are diabetic or having rheumatoid arthritis, and repetitive motion, obesity, and hereditary. And you can see in this image rheumatoid arthritis inflammation in the hand. There I have a specific video on that for the hand. Check it out on my YouTube channel. So how to get rid of the hand or wrist pain? In order to answer this question, we need to understand the normal healing cycle to get to the root cause of wrist pain. So I'm gonna use external paper cut here for visualization, but the same process happened internally from any of those conditions: arthritis, osteoarthritis, carpal tunnel, decrovant tendinovitis, Galgonian cyst. Any issue that happened here, it has to go through those 3 stages of healing. But because the skin covered it, we don't see it. So I want you to visualize what's going on internally. So first stage of healing is inflammation. You can see it in the first image here: swelling, redness, the blood start to rush to that area, and you start to experience pain and decrease range of motion. Second stage of healing is called the proliferation stage. That's when your body starts to build the scar tissue. During that stage, there's a cascade of events: fascia restriction, muscle spasm, trigger point, and scar tissue. During this stage, actually, our body has to build those scar tissue to heal. If our body does not build the scar tissue, it's open wound susceptible for infection. So any tear internally happen, if your body does not build the scar tissue, it's like there is no glue to glue things together. We need the scar tissue. The problem is if you have too much scar tissue, that could compress on a nerve, artery, cause carpal tunnel here. When the scar tissue or inflammation compressing on the medial nerve here, you start to have numbness and tingling. When you start to have a lot of scar tissue or inflammation, you start to have swelling in the joint and stiffness, and that will cause limitation in the range of motion and weaknesses. Perfect scenario, actually, during the maturation stage, our body should get rid of everything in the proliferation stage and inflammation stage. So that could take days, weeks, months, or years. Why scar tissue could be an issue? Because our muscle should act like a rubber band when you contract and relax. It should stretch like this. So when you have a scar tissue, it's like you have a knot in the muscle. And when your muscle contracts, it will not stretch much, and that will cause decreased range of motion, limited range of motion. And if the scar tissue on the nerve, artery, or vein compressing on it, that will cause a lot of symptoms. And in the joint, especially in the wrist here, we don't have a lot of room for scarring around the carpal tunnels. We don't have enough room for inflammation on this area. And with the 1 millimeter, 2 millimeters of inflammation or scar tissue, that could cause a major issue in the wrist. So we have, in order to treat the root cause of the problem, we have to break that vicious cycle of inflammation and proliferation. So to visualize internally, this is what muscles should be looking like: normal, healthy muscles, nice and smooth. And when you start to have micro tear, that micro tear is going to be very random like this. When that happens, your body has to build a scar tissue to glue everything together, and that's what's going to look like internally. And you can see it here for inflamed decurvin tendinovirus or carpal tunnels syndrome. That inflammation and that scarring is started internally to compress on everything around it. So how to treat the root cause of wrist pain? Before I go over that, I will go over several current treatments that used but not effective based on the studies. And when we relate that to the healing cycle, it will make a lot of sense why these treatments are not effective. So the first thing that very commonly used is steam, heat, and ice. When we look at a normal healing cycle, it will not break the scar tissue fascia restriction. It's not gonna cause decrease the inflammations. Temporary will relieve the pain based on the studies, but it's not addressing the root cause of the problem. So studies actually shows it's not really providing significant long-term pain relief. It's just short-term pain relief, temporary. The other thing that's commonly used is massage and foam roller. So massage and foam roller, think about this way: if you have inflamed tissue and you keep rubbing it, that will inflame it more. And when I go over the fascia system, it will make a lot of sense why massage and foam roller are not effective. And based on several studies, massage and foam roller either provide temporary pain relief or no pain relief. The other thing that's commonly used is stretching, and I personally do not recommend stretching to my patient, because think about this way: if you have a micro tear like this and you keep stretching it, you're gonna tear it more. So an action study showed stretching could increase the level of inflammation in that area. So there are other safe alternative option than stretching, and I personally do not recommend it. It will may cause more symptoms and make it worse. The other common thing that's used by a lot of healthcare providers: joint mobilization, adjustment, used by physical therapists, chiropractor, occupational therapist. And when we look at the normal healing cycle here, moving the joint is not going to decrease inflammation. Actually, too much of joint movement could cause more inflammation. It's not going to break the scar tissue and the muscle, the tendon, the ligament. And based on a study, it either provide temporary pain relief or no pain relief. So lastly, the other thing that's commonly used is strengthening exercises during the inflammation state. That's a problem. When you have inflamed tissue, torn or micro tear in the muscle, tendon, ligament, and you keep doing the strength exercise, that could cause more inflammation. We need to introduce strength exercises, but on the right time. We have to break that vicious cycle: initially the inflammation and proliferation stage, and then introduce strengthening. And I prefer to use function training, which is more effective than strengthening exercises, but we have to introduce that on the right time. First, we need to break that vicious cycle and then introduce the strengthening or function training exercises. One other thing I forgot to mention is commonly used is dry needle or acupuncture to work on the rest issue. The problem with that is it's not gonna break the scar tissue, the fascial restriction, and the trigger point. And there is a mixed study finding that it might not decrease the inflammation because actually the needle is not deep enough to decrease the inflammation. So there's not a lot of evidence support the efficacy of dry needling or acupuncture to really get break down that vicious cycle. So how to treat the root cause of the problem? So we have to break this vicious cycle. First, for the inflammation stage, if you have a minor inflammation, just rest for a week. Don't do the repetitive motion. Take it easy. 1 week should be enough if you have minor inflammation to calm things down. For moderate to severe inflammation, we have to be aggressive on breaking that vicious cycle. So what I personally do is I use the MagnaHeal 2. This is very strong magnetic device that actually the range of magnetic field is 3 inches. So I use it for carpal tunnel, for arthritis, for inflammation, and put it on a rest that's actually gonna decrease internal inflammation. That's why I said even dry needle or acupuncture, that's very superficial. It's not gonna really work internally, and there's hard evidence to prove that it decreases inflammation. So decreasing the inflammation is very important to actually decrease the internal swelling. So I prefer to use the MagnaHeal 2. The other thing I like to do is put my patient on anti-inflammatory diet, because a lot of several food that cause internal inflammation, based on a study, showed that certain foods that cause inflammation to 4 to 5 hours after eating, like refined carb, refined sugar, or alcohol. If that happens internally, that inflammation will not be decreased unless to really eliminate certain food. So I put all of my patients on anti-inflammatory diet to make sure we actually get that inflammation decreased internally and externally with using the MagnaHeal 2. And for moderate to severe inflammation, I also like to use the pain relief cream. That cream has vitamins, minerals, and herbs that actually help to decrease the inflammation. So I use it with the MagnaHeal 2 to work very fast to decrease inflammation. For severe inflammation, that actually the pain level from 0 out of 10, 7 to 10 out of 10, that's a sign you might have vitamins, mineral deficiency. And for those patients, I usually recommend to utilize the anti-inflammatory supplements, those specific supplements that, based on extensive studies, they are usually deficient with a lot of the slow to heal musculoskeletal injuries. So I personally do put the patient on those supplements to help decrease internal inflammation, while at the same time breaking down the scar tissue, releasing the fascial restrictions, because the stuff that work for inflammation is not gonna break down the scar tissue. So those two different issues, and it has to be treated, have the treatment targeting each of these issues simultaneously. So what I personally do for breaking the scar tissue, I use A3 to break superficial scar tissue. There's a certain protocol with that, and with the MagnaHeal, to make sure we're not causing internal inflammation. And I use A5 to break down deep scar tissue, release deep fascial restrictions and muscle spasm, because we have to work on the rest at the same time, because a lot of muscle connected to the hand from the rest. That's why I said foam roller and massage are not effective, because they're not going to go deep enough to break deep adhesion. And that's what brings me to the fascia system. It will make a lot of sense why foam roller and massage are not effective. So the fascia system is divided to two major categories: the superficial fascia and the deep fascia. And the superficial fascia wrapping the entire body. And you can see it here in this image. The white filament or white tissue here, those are the fascia layers. And when you go buy meat next time, look at the white filament. That is the fascia layers. So to make things complicated, but don't worry, the treatment is very simple. is each of these layers divided to 2 to 3 subcategories, 2 to 3 layers on the top of each other, and the deep layer is actually divided to 4 subcategories: apparatic fascia, that wrapping a group of muscles. Then we have the epimysin wrapping each individual muscle fiber. Then the premiysin wrapping a bundle of muscle fiber. And then at the end, you have the endomysin wrapping each individual muscle fiber. That's why I said massage and foam roller are not effective, because it's impossible mechanically with the hand, with the foam roller, to really go deep to release those deep adhesion on those tissue. And think about this way: if we cannot apply mechanical force to relieve deep or release deep adhesion, it's impossible to break it. So what I personally do is I use the A1 to release superficial and apparatic fascia layer. Then I use the A5 to really go deep and release deep adhesion, the epimysin, premiysin, and endomysin. To sum it up, how to stop wrist pain? Well, first of all, if it's a minor condition, just rest for 7 days. That should be good enough. Stop the repetitive motion, the typing, the playing the sports that actually could cause inflammation. That should be good enough to really get minor wrist pain under control. But if you have moderate to severe condition that actually your body going back and forth between the inflammation and proliferation stage, you have to be aggressive on breaking that vicious cycle from both ends. And remember, the stuff that we use to decrease inflammation will not work on the proliferation and vice versa. So we have to target each of those issues and address it to break that vicious cycle. And that concludes our video. And if you have any question or comment, leave it in the comment section below and I will answer it in the future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.